Hello, my name is Amanda Hester, and I'm delighted to be hosting Dr. Aleezé Sattar Moss and Dr. Diane Reibel as part of the Healing Healthcare Summit. In this session, we will be discussing mindfulness and compassion practices to foster resilience in clinicians. You can purchase lifetime access to all our Healing Healthcare Summit content in a downloadable format at mindful.org/healthcare. Dr. Aleezé Sattar Moss is the Associate Director of the Jefferson Center for Mindfulness at the Department of Integrative Medicine at the Sidney Kimmel Medical College at Thomas Jefferson University. She is a certified mindfulness-based stress reduction teacher who has been teaching for 15 years. Dr. Moss teaches mindfulness to healthcare professionals, medical students, and employees in corporate settings. She also offers a variety of mindfulness teacher trainings for professionals and conducts qualitative research on the effects of mindfulness training on physical and psychological health, the results of which have been published in numerous peer-reviewed journals. Dr. Reibel is the director of the Jefferson Center for Mindfulness and a clinical associate professor in the Department of Integrative Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. She has been teaching mindfulness-based stress reduction for over 25 years to patients, medical students, college students, and healthcare professionals, as well as to corporate executives and employees. She trained under the direction of Jon Kabat-Zinn himself, and Dr. Reibel was one of the very first teachers awarded mindfulness-based stress reduction teacher certification. She currently runs her own certification practicum for those wishing to learn more. Her research explores the physiological effects and health outcomes of mindfulness training and has been published and cited in both scientific journals and the popular press. Thank you both so much for being here today.
Thank you, Amanda.
Yes, thank you, Amanda. So Aleezé and I are really delighted to be part of the Healing Healthcare Global Mindfulness Summit. And when we were asked to participate, what we reflected on is, what we feel we could really offer the most. And so we really came to decide that offering practices, mindfulness practices and compassion practices would be what we would like to do. And also to speak a little bit about the research that has been done that supports mindfulness training for healthcare professionals and how it actually can help them with their own well-being and also their client or patient relationships. So what we're actually going to do is we will start with a short PowerPoint of some of the research that has been done. And we're going to do our best to help you to stay present throughout the PowerPoint. I know sometimes when we're watching screens with PowerPoint, it's very easy to kind of check out, but we'll bring some practices in to help support presence. So let's begin. Okay, mindfulness and compassion practices. Let's define mindfulness first so that we can are all on the same page with respect to mindfulness as it's defined in mindfulness-based interventions, which are used in healthcare a great deal. And this definition is from Jon Kabat-Zinn, who actually developed mindfulness-based stress reduction. And he says that mindfulness is awareness that arises through paying attention deliberately. He uses the word on purpose in the present moment with a non-judgmental attitude. Those of you who know Jon, he is wordy, and I like to unpack this a bit. So to do that, let's speak about 3 axioms of mindfulness. The 3 axioms are intention, attention, and attitude. The intention is to be present, to be aware. The attention is placed on what is actually arising in the moment. Very importantly is attitude. And it's really attitudes. John speaks of non-judgmental attitudes, attitudes of curiosity, openness toward experience, and kindness. And these axioms, they're engaged simultaneously in the process of being mindful. So I just want to step back and say that mindfulness is a natural human capacity. We all have this capacity to be fully present and to be aware. And I am sure in your life, you know those times where you are really fully present and aware. Perhaps it's when you are in nature or listening to your favorite music, or perhaps with an interaction with another where you're fully engaged in that interaction. So while it is a natural human capacity to be fully present, my sense is most of you know that it's often not the case that we're fully present. We are often quite distracted in the moment, with our minds going off into the past or into the future and not being in the moment. So I don't know, but perhaps you can relate to this little cartoon that says, "What is that?" And it says, "Oh, just my mind. Mind that is cluttered, that's all over the place, scattered, and certainly limits the ability to be present." So let's just take a moment right now and check in and see, where is your mind right now? Just notice. Are there lots of thoughts? Are you moving on to the next slide or to the to-do list or somewhere else? And if you notice that, just see if you can kind of bring the mind into the present. And one way to do that is to really bring your attention into the body. The body is a gateway to the present moment. The mind can time travel, but the body is here now. So perhaps taking a moment and just noticing the sensations in the body, where you make contact with whatever it is that you're sitting on, how that feels. If your feet are on the ground, really sensing the ground beneath you. And perhaps just getting a sense of the entire body sitting here now. Now, if you have closed your eyes, just gently open them and check in after just doing, maybe 60 seconds of a mindfulness practice to notice what's happening in the mind and body and get a sense. Did that in any way support you to be more present? So again, while mindfulness is innate, we know that we're not always mindful. The great news is that it can be cultivated through the formal practice of mindfulness meditation. So we can strengthen our ability to be present. And indeed, that is where mindfulness-based interventions come in, because they involve the training in mindfulness meditation to cultivate present moment awareness. And there has been, for the past few decades, growing research on the benefits of mindfulness-based interventions for both clinical and non-clinical populations. Now, what we're going to focus on is just a few of the more recent studies on mindfulness-based interventions in healthcare professionals. And there have been many different mindfulness-based interventions studied for healthcare professionals, including the standard mindfulness-based stress reduction program and mindfulness-based cognitive therapy programs. And these programs are, in general, 8-week programs, and embedded in the 8-week programs are a day of retreat. There are also some abbreviated mindfulness-based interventions that have been developed, and some specifically developed for clinicians. We, for example, have developed a mindfulness tools for healthcare professionals program, which is a shorter program than the standard MBSR, although it's modeled after that. There's also telephone and web-based programs that are being used and also doing, having research being done. And more recently, mindfulness apps. So here's a 2017 systematic review and meta-analysis. And this included physicians, nurses, midwives, OTs, and mental health professionals who took various forms of mindfulness-based interventions. And the evidence strongly shows that there's significant reductions in stress in the healthcare professionals that take the MBIs, significant improvements in emotional exhaustion, in depersonalization and personal accomplishments. And all of those are indices of burnout. So basically, the fact is that it reduces burnout in these studies, and also showing a significant increase in self-compassion, which is obviously very healing for the clinician, and then also can greatly increase their ability to have compassion for their patients or clients. Here's another review, and this is a 2020 review of 25 studies. This was with physicians. And what they found was enhanced well-being, reduced burnout, reduced stress and anxiety, and enhanced empathy towards patients. So in this 2020 review, also what they found is the MBIs, again, it wasn't just for the clinician wellness, although that was certainly improved, but so was therapeutic presence. And therapeutic presence is one of the #1 factors in the clinician-patient-client relationship that supports healing. So attentiveness, the ability to be fully present with patients, physicians said that they were enhanced. And there's actually been studies where it has been shown in the actual interaction between the clinician and the patient, enhanced attentiveness and more ability to listen deeply to patients' concerns and to respond consciously more effectively to patients, which is no small thing by any means. And I'd like to just mention that there's a great deal of evidence now that mindfulness-based interventions can actually help during training, health professional education. And actually, when I started the program at Jefferson 25 years ago, which we're very, very excited about, this is our 25th anniversary. The first program that I ever taught was for medical students. And it was a trial program, a 4-week program, and it was so highly successful in that the medical students really felt it was beneficial that we started having a 10-week mindfulness program, which was embedded in the curriculum. And we actually published a paper on this in 2003, a very early paper, which showed that the medical students who chose the mindfulness program, while they had higher stress levels to start with, because that's who wanted the stress reduction course, they, compared to other medical students who did not take the mindfulness program, had a reduction in profile of mood states the closer that it came to taking finals, which means that they had less tension, less depression, less fatigue going into finals, significantly less than they started with at the beginning of the semester, and significantly less than medical students who didn't take the mindfulness program. Kind of was like a crisscross in the sense that those who took the mindfulness program while they started higher, they really had less stress. Whereas what usually happens with medical students, and I think students in general, is you might not be that stressed to start with, but you get closer to finals and you get more and more stress. So that was actually one of the first programs, and also evidence that this mindfulness could be really supportive for medical students. And as you see here, this is a systematic review of mindfulness-based interventions, 19 studies, and includes training people who are training in medicine, psychology, nursing, social work, OT, PT. And what was found is significant reductions in anxiety and depression, enhanced mindfulness, improved mood, self-efficacy, and empathy. So I do want to make it clear that mindfulness is not a magic bullet by any means. It's not a panacea, and it cannot address all of the causes of burnout that are taking place in healthcare right now, and there are many. However, healthcare professionals can enhance their inner resources and resilience through mindfulness and through compassion practices. That has been shown. And certainly Dr. Moss and myself have seen that firsthand with the healthcare professionals that we train. So I'd like to move on to a practice. And this practice is called Pause, Relax, Open. And it's a brief practice that really can support us to kind of step out of automatic pilot and offers the possibility of consciously choosing new responses to whatever we're experiencing in the moment. And when we do that, we step out of automatic reactivity, then we have more options to choose wise and more beneficial responses. So just these are instructions. It's a slide, but I'm going to really invite you just to let this slide and the instructions go. It's there for the future if anybody wants to review the instructions. But for now, what I'd like to do is invite you to actually have a direct experience of this practice. So I'll stop sharing the slides and invite you to kind of check the position, the posture you're in, and make any adjustments that feel right for you. To be as comfortable as possible, and also to be in a posture that This supports alertness. And the first step of the practice is pause. And the pause really is about checking in, becoming aware of what's actually happening in your own body, your own mind. So it's an invitation to bring the attention into the body right now. And just noticing what is arising. Perhaps you're noticing areas in the body that are holding. Or perhaps there's areas in the body that you're noticing are more relaxed. And in this step, it's not about doing anything or changing anything. It's really just about becoming increasingly aware of what is happening in the moment. Perhaps you can notice once again where you make contact with what you are sitting on and how that feels. To feel the support beneath you. Maybe you are noticing sensations of temperature, coolness or warmth in the body. Or perhaps noticing air against the skin. Or how the hands are resting in the moment. Again, it's really not about changing anything right now. It's about bringing a curious, kind attention into the body in the moment. And then noticing the mind and how it is. Is it very busy? Are there lots of thoughts? Or not so many? Is the mind alert? Is it drowsy? Keep in mind, it's not about judging what you find by any means. It's simply about being curious. How is my mind right now? And then noticing any mood states that might be present. Perhaps there's a sense of calm. Perhaps there's a sense of agitation, restlessness, boredom. You don't want to be doing this. Or maybe, yes, this feels good right now. Just see for yourself. And again, as much as possible, curiosity and kindness. And now the second step is relax. Relax isn't a demand to relax. It's an invitation. Sometimes we invite something to happen and it happens. And sometimes we invite something to happen and it doesn't happen. What's really important really is your relationship to what's happening. Can you just be open to experience? So for now, the invitation is to incline toward ease. So are there any muscles in the body that can let go a little bit, that you don't need to be using so much right now in this moment? See for yourself. Perhaps the forehead can soften a bit. Or maybe there can be softening around the eyes or the jaw. Or perhaps muscles in the neck. If it feels right to move the head in any way to soften muscles, then perhaps you can choose that. And if so, to do that very mindfully, feeling the sensations of movement. And perhaps the shoulders could drop down a bit or back a bit, or expand from left to right, bringing in some more space, breathing space. And then if it feels right for you, you may want to take just a couple of relaxing breaths. We call them relaxing sighs. In through the nose and out through the mouth with a gentle sigh. Again, if it's helpful, in through the nose and out through the mouth with a gentle sigh. And then the next step of pause, relax, open is open. And opening can happen naturally, just as we pause and relax. It can have a more open sense in the body and the mind. And then we can also consciously choose to open a bit more, even beyond ourselves, to our environment. So perhaps really opening right now to receive sounds and allowing sounds to be the primary focus right now. The sound of my voice, but also sounds in your environment. Perhaps sounds in the room you're sitting in, or distant sounds. Opening to hearing sounds. And in this sense of opening, we can also open to others. And it's a wonderful way to practice mindful communication, to pause, relax, and open so that we can listen and be present. If your eyes are closed, just gently allow them to open. And perhaps looking beyond the screen, being mindful of the environment and colors and shapes, lights. And as you do this, opening to sounds and the environment, as much as possible, continue to stay in touch with your body here and now, so that there's a sense of embodied presence. And just notice how it is right now after doing this practice. I believe the practice was maybe 5 minutes or a little longer. I wasn't timing it exactly. But this practice can be done anytime, anywhere, any length of time, duration. You could do it for longer periods of time, but you can also do it for 30 seconds or a minute. The acronym to remember is PRO. PRO, pause, relax, open. And small glimpses, many times we say. So anytime that you can remember, just to simply pause. And again, it doesn't mean you have to totally stop what you're doing. It means become more aware, notice, and then invite ease, and then open. So whether it's before you talk to a patient or client, or when you're opening the door to go somewhere, or washing your hands or walking, remember this is a wonderful practice to bring into day-to-day life to support you. So I will leave it at that and then turn this over to Dr. Moss.
Thank you so much. Thank you for the practice. We certainly feel more awake. And I'm going to share again a PowerPoint, just a few more slides. And in this section, I'm going to talk just a little bit about compassion and the difference between empathy, compassion, empathetic distress. And we'll spend most of whatever time we have left doing a compassion practice. So compassion, defining compassion, the definition that we find really helpful, powerful, is that compassion is to be fully present to someone's suffering while also wishing them to be deeply free of that suffering. And with self-compassion, you are that someone. Now, empathy and compassion are certainly related, but they're not exactly the same. And understanding this difference is important in alleviating empathetic distress, which is often called compassion fatigue, misnamed compassion fatigue. And empathetic distress is an important cause of burnout in healthcare professionals. So this image is from an article called Compassion Does Not Fatigue. And empathy is this natural human capacity that is the first step in building connection. Empathy is what allows us to resonate with the feelings of another. We can feel happy when someone else is enjoying good fortune, feeling joy, and we can feel distress when we observe someone else in physical or emotional or mental pain. Now, sharing the positive emotions with others is very pleasant, but sharing the negative emotions, sharing the pain of another can be quite difficult. And when we take on this pain that we observe in someone else, when we take on other people's physical or emotional pain as our own, empathy can turn into empathetic distress. And repeated episodes of empathetic distress can lead to burnout that's characterized in healthcare professionals as emotional exhaustion, withdrawal, depersonalization, decreased sense of personal accomplishment. So with empathetic distress, where we're taking on this pain as our own, it leads to withdrawal and aversion. In contrast, compassion is characterized by feelings of warmth, concern, care for the other, as well as a strong motivation to improve others' well-being. Compassion goes beyond feeling with the other to feeling for the other. So we don't take on their pain as our own. Unlike empathy, compassion enhances positive emotions in response to adverse situation. And this counteracts the negative effects of empathy that are elicited by experiencing others' suffering. So the good news is that empathetic distress can be reversed. We can learn how to turn empathy into compassion. And compassion is something that can be cultivated. And what research shows that even short periods of compassion training can help participants continue to feel empathy, feel open when we witness the suffering of others. And it can help us gain the capacity to feel positive emotions without feeling distress. A recent study done in 2020 found that self-compassion can have a protective effect on burnout in healthcare professionals. So we're going to move into a practice that helps us cultivate compassion. And this practice is called strong back, soft front, and it's adapted from the work of Joan Halifax, Frank Ostayaski, who are meditation teachers who work a lot with people who are suffering deeply and who also do a lot of work with healthcare professionals. So I'm going to stop the sharing as I move into guiding the practice. And before I actually guide the practice, just a little quote from Joan Halifax, what she says about this practice. So she writes that strong back, soft front is about the relationship between equanimity, which we might also describe as the balance and stability, and compassion. So strong back is the stability, our capacity to stay grounded, centered. And soft front represents compassion, our ability to open ourselves, our hearts to things as they are, including opening to suffering, both of our own and that of others. And to meet the challenges and difficulties in our lives, we need both. We need the strength and the capacity to stay present. But along with that strength, we need that soft front that's receptive, responsive, compassionate, and loving. And so often we have it the other way around, a defended, armored front with our backs collapsing under the weight of things. But again, the good news is that we can cultivate these qualities of equanimity or stability and compassion. And that's what this practice is about cultivating and nourishing these qualities and about nourishing ourselves. It's not about forcing ourselves to feel anything in particular. So if you'd like to adjust your posture in any way as we move into the practice, please do so. Really finding a posture where you feel as comfortable as possible, and at the same time where you feel awake. You can practice with your eyes gently closed, or you could keep the eyes open with a soft gaze. Just seeing for yourself what most supports you to be present. And inviting attention to come more and more fully into the sense of the body in whatever posture you're in. Feeling the contact that the body's making with the support beneath you. And as you feel into this contact, this recognition that there is indeed a support beneath you, really inviting yourself to be fully supported. Letting go as much as you can of any sense of holding in the body that's not needed right now. Maybe letting the breath support you. So each exhalation can carry a gentle invitation to let go just a bit more. But really holding it as an invitation. So not forcing anything to happen, but just breath by breath. This invitation, this encouragement for the body to release and let go of any tightness, holding, that the body is able to release. And really taking in this connection that the body's making with the support, the ground beneath you. Feeling into the possibility of being grounded, of feeling that stability that is available. And you're just encouraging attention to come more and more fully into the feeling of the body. But you don't have to try to get rid of anything else. You can let thoughts, mood states come and go. Inviting attention to rest, the sense of the body, perhaps the feeling of the body breathing. With mindfulness practices, there's no right or wrong way to breathe. We're simply letting the felt sense of the body, and perhaps more specifically, the felt sensations of breathing, to support attention to be present. And you'll notice attention does get pulled away, wanders off, gets caught up in thought whirls, and knowing this is not a problem. No matter how often it happens, whenever you notice it, is a moment of awareness, a moment in which you can bring some kindness, care, and then gently escort the attention back, perhaps to the feeling of the breath, the feeling of the body. And as you're ready, gently bringing the attention to the region of the back, the area of the spine, this strong, flexible, conductive spine. Sensing into the long muscles that accompany the spine. They have your back. Now keep in mind, this is not so much about physical strength, no matter what condition our spine or the muscles of the back may be in. It's okay. It really isn't about muscles as much as strength and flexibility of mind. It manifests in your back. So this is more metaphoric, but it is supported by bringing attention into this region of the body and letting sounds, thoughts, emotions come and go. As much as possible, that's a little more in the background. The feeling of the body, this region of the back, a little more in the foreground. Strong back that's willing to bear witness, to meet things as they are. If it's helpful, you could even just gently whisper to yourself, strong back. And knowing that rigidity is not strength. So allow yourself to relax as much as possible, both body and mind, relaxing even as you feel into the quality of strong back. You don't need to put in a lot of effort here. This light touch of attention, connecting with this inner strength through strong back. We can discover our capacity to meet anything, to uphold ourselves in the midst of any condition. And once we can feel into the stability, the balance that's available with strong back, we can open and have a soft front. So as you're ready, gently bringing your attention to the front of the body, keeping in mind the qualities of non-judgment, of curiosity, and just sensing into the potential to open and receive through soft front. Nothing has to be left out. We can open to vulnerability. We can allow ourselves to be just as we are. Resting attention in this soft front that's open, receptive, caring. So often we're actually quite armored here. There's a way to protect ourselves. And seeing if just for now, you can touch into the experience of the moment. This quality of openness, tenderness. Knowing that attention wandering off is not a problem, even if it happens again and again. Whenever you notice that, you can bring in this quality of kindness, compassion, just perhaps gentle whisper of soft front. Not forcing anything to happen, but just feeling into the possibility of softening, opening. Soft front that's porous, permeable, allowing in both the beauty and the challenges that are present in our lives. Strong back, soft front. We need both. It's hard to open without the support of the strong back. But without that openness of soft front, we can become rigid. Strong back, soft front. Sitting with the support of both, we can drop into a space that's deeper than our stories, than whatever may be happening. And we can allow the innate positive qualities of our being to arise in order to enrich our own lives and to support others. And just for a few more breaths, allowing yourself to rest. And very gently expanding attention beyond the sense of the body, opening to the space around the body, opening to the sounds in your environment. If you've been practicing with your eyes closed, allowing eyes to open as you open to the visual field of your environment. Really just noticing how you are and allowing yourself to be as you are, knowing that that in and of itself is a radical act of kindness. So here we are in this moment. As we get to the end of our presentation, I would like to share our information. If you have any questions, where you can reach us, and where you can also find many guided mindfulness meditations. You have our website, you have emails for both of us, and we really mean it. If questions come up, feel free to reach out to us.
Thank you both so much for that incredible presentation and that generosity in sharing your contact information. That was amazing.
Thank
Thank you
you.
so much for hosting us.
Yeah.
And
It's a delight, really a delight. And
Thank
for all of you listening, take the best of care.
Yes, thank you all for being here. Mindful Magazine is the world's leading secular mindfulness publication, and you can get access to our digital library of articles, guided meditations and videos, plus 6 beautiful issues delivered to you throughout the year. Going to mindful.org/healthcare-subscribe if you want to learn more. And we're offering our summit attendees a special subscription rate, so that's exciting. Finally, please rate this session before you leave. There's a rate session button below your video in Whova. And as with everything we do, your input is very helpful to us. So thank you, Dr. Moss, Dr. Reibel. Thank you all.
thank you, everyone.
Thank
Be
you.
well.
Bye.